Good morning and welcome. Today, we are going to talk about why you should become a fellow of the American College of Surgeons, and importantly, how to do so. With me today is Karen Freeman. She is the manager of the credentialing team in the Division of Member Services at the ACS. She and her team receive, verify, process the applications, and then hand those approved applications off to the volunteer-led Committee on Applicants to interview and then recommend for fellowship candidates to the ACS Board of Regents. Welcome, Karen.
Thank you, Dr. Bankhead Kendall. It is a pleasure to be here.
Also with me today is Dr. Ryan Dumas, who became a fellow in October of 2020 to share his experience while it's still fresh on his mind with the application and interview process.
Thank you, Dr. Bankhead Kendall. It's a pleasure to be here.
All right, so let's start by talking about the application cycle and what needs to happen first to get the whole process rolling. Karen, can you start by letting us know what's required in this application?
Oh, absolutely, Dr. Bankhead Kendall. We have both domestic and international applications, and it's just a slight difference between the two requirements of both. Let's start with the domestic. With our domestic application, you need to be board certified by the American Board of Medical Specialties, either the Osteopathic Board or the Royal College of Canada. We need proof of you having practiced 1 year independent surgery. You need an active license from where you're practicing, a current appointment on a surgical staff at a hospital, we're going to ask you for a copy of your curriculum vitae, and names of 3 ACS fellows, and one of which must be a chief of surgical staff. What's needed for our international applications is, of course, you have to be board certified in your country. You have to have 3 years of surgical practice and proof of a current appointment or on the surgical staff at your hospital. We'll also ask for a copy of your curriculum vitae, and we will also ask for the name of 3 fellows of the American College of Surgeons. All applications are submitted online, so we encourage our applicants to have all the information ready when they're ready to sit down and fill out the application.
I see. Thank you, Karen. So what happens after all of this has been given then to the ACS staff?
Once we get your application, you'll probably get an acknowledgement email from ACS. All of our communications really is basically via email. So you'll hear from us in about 15 days from the application and say, we have your application and we'll start processing it. So within the next 30 days, staff will review your application, see if there's any missing information or any missing documentation. And at that point, we will ask you for your surgical list. The application cycle as it is today is, the deadline is December 1. After you have a completed application, and probably from March through the middle of May, you'll be contacted by our committee on applicants, by your local committee on applicants, and they will schedule an interview for you. Once they get the interview reports back, we submit it to the Board of Regents for an approval to become a fellow that October.
Great. So can you expand on that maybe a little bit more? I've heard that there's maybe a dashboard involved in this process. It seems like it takes about a year.
Absolutely. It could be longer than a year, actually, but there is a dashboard on involved. You have an application status that you can check on this on the website. You can check on the status of your application. It'll tell you that we received it. It'll tell you when we processed it. It'll give you the date when you need your surgical list, and it'll give you some more information, like if you're missing something. Once your application is completed, we will tell you that it's gone to your committee. Once you interview, your committee gives a report back to our Committee on Applicants administrator. She will process them, give them back, and make sure that everyone's record is updated properly. If an applicant is not recommended by the committee, then we send them to the applicant review committee, where there's further investigations going on, so that we can ensure that that we cross our T's and dotted our I's and made sure that everything was correct before we would postpone you for a year.
I see. Thank you, Karen. Dr. Dumas, again, welcome. So what was your experience? It's really fresh on your mind. What was your experience with the application process?
Yeah, that's a good question. I mean, honestly, thanks to the staff of the college and a lot of the online resources, and also just having talked to other colleagues, it was pretty seamless. I think, like many of these applications, the key is really preparing ahead of time. Format your CV, keep it up to date the moment you start your first job as sort of a living document. And then that way it'll be regularly updated with your accomplishments. And when the time comes to submit your application, it'll be one less thing to do. The case log is really important, and that's probably one of the trickier components that some applicants have questions about. And honestly, depending on what kind of institution you work at, the best resource is probably your institutional administrative support, who they can usually generate a list of your case logs. And that may include other things like E&M billing codes and other things, where you can sort that list and drill down on just the operative CPT codes. And then that will give you a really robust list of everything that you've done over the previous 12 months that will count towards your FACS application. There's also other registries. Actually, the college has a registry that can be used to track and record cases, and certainly you can do it manually yourself. But I think the institutional support was really helpful for me.
Awesome. So a lot of the unknowns, I think, that give applicants some amount of angst is the interview. So Karen, can you talk a little bit about how applicants might prepare for the interview, how many people are typically there on the panel, and maybe what kind of questions they might be asked?
Oh, absolutely. Once you get to the interview, they ask mostly questions about your case list. They may ask you about a difficult case that you've done, or they may even ask you about something that you've done that you wish you had done differently. So be sure to have your case list with you, because they may even ask you about a specific case on the case list. They also are going to want to know your ethical standing in your community, as well as, how your after patient care. All of that is very important in terms of how they will recommend you to become a fellow of the American College of Surgeons. One thing I'd like to add, the interview does not last that long. It could be maybe 20 minutes, unless there's something like really intense or something that they really want to talk about. It's usually no longer than 20 minutes, and that's long.
Thank you so much. So Dr. Dumas, maybe you can tell us a little bit about your experience with the interview. Was it terrible, great, somewhere in between? What was it like?
Yeah, I mean, absolutely, Dr. Benkett-Kendall. The interview was, as Karen said, very friendly and very straightforward. Really, like most interviews, the interviewer's goal is to get to know you. They'll review your cases, and they'll also make sure that your case list is consistent with your training. They'll also discuss your references, and they may even know some of your references that the surgical community is still a small one, and they're going to want to know that you're in good standing with your peers as well. Now, remember too, the interviewers, they want to hear how you're going to be involved in the college, not only at the national level, but also at the local regional level. So for example, here in the North Texas American College of Surgeons, we have a robust mock oral curriculum, and we always encourage members to become a part of that training for our residents.
Awesome. Thank you, Dr. Dumas. So Karen, what happens then after the interview, and when can an applicant expect to hear they'll be anxiously waiting about the status of their application?
That's a great question, Dr. Bankhead-Kendall. What happens next is the applicant waits. Our applicants start hearing from ACS about their status from June through July 31st. And it feels like a long wait time for our applicants. I know they're very anxious to hear.
So this video project really came about because of a session at the RAS ACS Associate Fellow Committee that was held as a lunchtime session at the Clinical Congress. So in the interest of that, do y'all have any suggestions for applicants that you would like to share personally? Maybe Dr. Dumas, we could start with you.
Yeah, I think some of the takeaways for me from this process, we're starting early. Don't ask for your references at the 11th hour. Give them lots of leeway. Maybe even sit down with them and talk to them about your application, because they will have been intimately involved with the college as well, and may have advice and recommendations. And then that includes your CV and all your other components that you're going to complete your application. And finally, remember that you can apply for fellowship immediately following completion of your formal training. So that means that if you're doing, for example, an unaccredited year where you may have a clinical instructorship or an appointment at a teaching institution, but it's not accredited training, and those cases can count towards your FACS application. So that can kind of move the timeline ahead for some of those who are doing additional advanced training.
Thank you so much, Dr. Dumas. Karen, do you have any other thoughts you'd like to share with potential applicants to help them and by them, I mean me, us, as we go through the application and the interview process?
I encourage you to get started for sure. And just to let you know that we have a credential analyst assigned to our applicants. And if they ever have any questions, they can always call us. We're calling it a rolling initiate cycle, where every year we have the December 1 deadline. We're going to get rid of that deadline. And depending on when your application is completed is when we'll try and go for it at your interview. You may be an initiate longer, at least that part to be done with. So we're going to do the initiate, a rolling initiate 3 times a year and confer everyone still in that October. We thought that, instead of the long year wait period, that may make our applicants a little happier.
Fantastic. Thank you so much, Karen, for coming on today and sharing all this with us. Thank you, Dr. Dumas, for sharing your personal experience and some advice for us. Thank you all so much.
Thank you.
Thank you.